Okay, so today we start with a completely new branch of medical sciences, which is, as is evident from the drawing itself, the medical science is related to the study of the human eye. That is ophthalmology. Now I know I haven't been the best at uploading videos or being consistent with my videos as such, but I really have been a little busy. So, like being a doctor myself, not really a doctor, more like an intern right now, but like I am to become a doctor. It's kind of a busy life that I lead, so I don't get much time for making videos or taking out time for editing and stuff like that. So basically, I have some time now, so I decided to, why not start like a completely new branch of medical science studies, something that I haven't really, uh, done in my channel before. And then it struck me, why not start with the human eye, the ophthalmology part. So basically, how will we be dealing with ophthalmology? I think I'll be making multiple videos on ophthalmology, and in this video, or rather in the next few videos, we will be dealing with the anatomy of the human eye, as is evidenced by my somewhat decent, somewhat bad drawing imitation of the human eye. And if it wasn't clear, it is an eye, as is evidenced by the big, bold word here. Anyways, so what will we be dealing with? We will first deal with the anatomy of the human eye. Now, the anatomy of the human eye itself is a big topic, right? So, we will be breaking that up into different sections as well. In this video, we'll be dealing with only the introductory part of the anatomy. Okay? Just the introduction. Just, a synopsis of what is to come. Then, we'll be talking about the different parts, the different layers of the eye, and then individual layers will be dealt with in individual separate videos for getting a holistic approach to the entire anatomy. Because once we are not just studying the anatomy of the human eye, or we won't be just studying the human anatomy as far as the eye is concerned, we'll also be dealing with the somewhat correlated pathologies, diseases. So this is basically a clinical anatomical study, not just theoretical anatomy, because we are studying a professional course, MBBS. So everything we study has to help us in treating patients. That's the goal here. Anyways, so the eye. First question that comes to our mind is, what exactly is the shape of the human eye? As is evidenced by the picture here, the shape of the eye is spherical. That is why we say that the eye is an eyeball, don't we? We use the term eyeball, right? But is it really spherical? No, it is actually aspherical. This is why our understanding as doctors is more refined, or has to be more refined than the layman. Although the eye looks spherical, it is actually aspherical. Then what exactly is the shape? It is actually something known as an ablet spheroid, which means that it is not completely a tennis ball or a cricket ball or a badminton ball or whatever. No, badminton ball. No, sorry, badminton cork. Badminton does not use ball. I meant basketball. So it's not exactly spherical like those balls. Instead, it is aspherical. It is somewhat flattened at some parts, elongated at other parts. So it is not exactly spherical. Second fact about the eye is, since it's a 3D structure, what is the volume of the eyeball? Well, it is 6 ml, 6 milliliters. Then, what is the length, or rather, let me be more specific, what is the anteroposterior diameter of the eyeball? What does that mean, anteroposterior diameter of the eyeball? Anteroposterior diameter means that if I were to measure the length of the eyeball from here, its most anterior most point, to its most posterior most point, then what will be the length of it? Well, that will be approximately 24 millimeters or 2.4 centimeters. Okay, these are, you might feel like these are factual things, and these are facts, but these are going to be very, very important to us. Why? Let me just exemplify. Suppose you are doubting whether you should remember the anteroposterior diameter of the eyeball or not. Like, how does remembering what the exact length of the eyeball is helpful to us? I'll tell you how it's helpful. In cases of myopia or hypermetropia, where the eyeball elongates or shortens, the light rays, suppose this is the eyeball, right? Normally light rays from infinity are parallel to each other, and they would be converged by the eye on its retina, which is the image forming layer, as we will see later. Okay, that is how an image is formed. But if the eye were to be longer, then the image will not be formed on the retina, but rather in front of it. And what would happen is we would get a blurry image. Okay, same thing would have happened, or rather the opposite would have happened, if the eyeball was shortened for some reason. So that is why we need to be exact with the anteroposterior diameter of the eyeball. These are important facts. These are factual things, need memorization, but are very, very important. Now, what exactly is the eyeball situated in? As we can see from this image, the eyeball is situated in a bony orbit. We have all seen the pictures of human skull, and we have seen that the human skull has those, sockets for the eyeball. Those sockets are what we say to be the orbit, right? The eyeball is lodged inside it. So think of the orbit as a three-dimensional room, like exactly the room that you're sitting in right now. So the room that you're sitting in right now has a roof, has a floor, and it has walls. Just like that, the orbit also has a roof, a floor, and two walls, a medial wall and a lateral wall. As is evidenced from this picture, this is the medial wall, this over here is the lateral wall, this is the roof, and over here is the floor. So it is exactly like a 3D room, the room where the eyeball lives in. Done. So we have found out that the volume of the eyeball was approximately 6 milliliters. Then what exactly is the volume of the orbit? The volume of the orbit will obviously be more than the eyeball. That is one hint that you already have. So it is definitely more than 6 ml. How much more? As it turns out, a lot more. It is 30 ml. It is 30 ml. Because if you think about it, the eyeball is a structure that is situated within the orbit, but it is not the only structure. There are a lot of other structures in the orbit as well. There is the fat, the extraocular muscles, the nerves, the blood vessels, all of them are lodged in the orbit as well. So the orbit needs a lot more volume, which happens to be 30 milliliters. Done? Done. Now, let's come to the more interesting sections of the anatomy, which is what are the parts of the eye. So what are we seeing here in this image that I've already drawn here? It's not a very good image, but I think it will get our job done. See, how do we study the anatomy of anything for that matter? When we are studying the anatomy of anything, we basically deal with it in two sections: a gross anatomy and a fine or microscopic anatomy. When we are talking about the gross anatomy of a structure, we are talking about the things that we can actually see with our naked eye. Or rather, let me put it like this: the things that we can visualize in the anatomical position. So for example, when you're seeing a human eye, what are the things that you can already see? You can see that there is this white portion, there is this blue portion, there is this black portion, there are these eyelashes, there is eyelid, two eyelids, right? These are the gross anatomical parts of the eye. But if we are to really study the anatomy of a structure, we need to study it in a cross section, some form of a section. So what we have done here, and that is what is represented in the right side picture, is we have basically sectioned the eye like this, and then we are seeing it from above. Okay, so the eye, we cut it in half just like this. We took a transverse section, that is, and then we are seeing it from above, and that is what we are seeing here. Okay, why have we done this? We have done this for better understanding the different parts, or rather the different layers of the eye. So if we are to be blunt about it, let's just first get the factual things out first. There are 3 layers of the eye. Let's write them down. 3 layers. What are they? Just nothing. No fancy name for them. There are fancy names for them. Actually, there are fancy names for them, but first let's get the basic things out first. The outermost, the middle, and the innermost layers. ठीक है? So I just I just blurted out in my mother tongue, Bengali. Anyways, so the outermost, the middle, and the innermost layers of the eye. The outermost layer is known as the fibrous layer. Okay, the middle layer is known as the vascular layer, and the innermost layer is known as the neural layer. Okay, now with that out of our way, outermost, let's talk about that layer first. So here we have over here a picture of the human eye, right? What is the outermost part? So think about it. When you are looking at the eye from outside, which layer of the eyeball will you probably visualize? Yes, the outermost layer. So that is exactly what we'll be doing. The outermost layer. So the outermost layer itself is a continuous layer all around the eye and is divided into 3 parts. First, the sclera. Let me first name them for you, then I'll explain to you what these are. Second, let me use this as well. Cornea. And third, the limbus. Now obviously we will be dealing with each of these structures, sclera, cornea, limbus, in a lot more detail in subsequent videos, but in this video we are just jotting them down. We are just trying to understand what they are on a very broad basis, and just laying down the foundation for future understanding. So you can see that we can see a white portion over here, right? This over here, this white portion is what we say to be the sclera. Done. Then we can see a blue portion. Is the blue portion cornea? No. Cornea happens to be transparent. Cornea happens to be transparent. So what happens is, this sclera, it is a white tough structure, fibrous structure. On both sides of the eye we can see it. In fact, I'll give you like another fact right now. Let's go back to that picture. See this entire white structure over here, this outer white layer, this is actually the sclera, except this part. Which part am I talking about? This is the cornea. From here to the entirety, like this entire white portion, this is sclera. So the sclera is actually surrounding the eyeball in completely. It completely protectively covers almost the entirety of the eyeball. Okay, it is extending from the cornea in front up to this structure over here, which is the optic nerve. This entire white structure that I have drawn is the sclera. Okay, done. Then what is the cornea? The sclera is a protective opaque covering. Now think about it. The function of the eye is vision. So can a protective opaque covering cover the entirety of the eyeball if light has to pass through the eye for the eye to actually have vision? Obviously no. So the sclera cannot be present everywhere. Where can it not be present? It cannot be present exactly where light needs to enter in the eye, which is through the front, where the sclera becomes transparent and forms a special structure called the cornea. So let's go back to the, yes, this one. See, this entire, like if I'm to draw this entire thing is actually transparent. Okay, this entire thing is transparent. Sclera becomes transparent in front of this eyeball like thing, this round structure in the eye. As you can see, it is actually transparent. That is actually what we say to be the cornea. So if the cornea is transparent, obviously it won't have a color because light is passing right through it. Then what are the structures that we can see inside? What is that blue structure? We will see later that that blue structure is what we call to be the iris. Iris is not a part of the outermost layer of the eyeball, but rather the middle layer of the eyeball. So we will deal with it subsequently. For now, just remember that this is the, let me just get the white one out. This is sclera, 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 and then this again is sclera, sclera, sclera. In this middle portion, this is transparent. This is cornea. Done. Now, since it is transparent, it is acting like a window for the light to come in. So we can see the deeper structures in the eyeball. What is deeper to the outermost layer? The middle layer. That is why you can see the middle layer, or rather part of the middle layer, which is the iris, which is the blue portion over here in this picture. Done? Done. So that is cornea. Now, we have another thing, the limbus. What is the limbus? Limbus is nothing. It is just, if I can just rub this entire thing. So limbus, now you know what the cornea is. Cornea is this transparent thing, right? Limbus is basically, let me just use this. See, the junction between the sclera and cornea is limbus. That's all. So that entire junction, this entire, thing where the sclera and cornea fuse, that is limbus. Why does limbus have a different name? Like the junction between sclera and cornea has been given a name. When anything in our body, or like even in particular in life, is given a name, most of the times that means it has a special function, a reason for that naming. Like my fingertip does not have a special name, right? The tip of my nose does not have a special name. The ends of my hair do not have a special name because they individually don't serve any purpose, or rather function. They do serve a purpose, but not an individual function. Limbus, on the other hand, does have very important functions. We will see that when we talk about cornea and sclera as a separate video. Okay, just know that this is the outermost layer, and now we have successfully dealt with the outermost layer of the eye, which is the fibrous layer. So sclera, as I have already told you, is that outermost opaque white protective covering which extends from cornea in front to the optic nerve in back. Another interesting function of the sclera, apart from, protecting the eye and supporting the eyeball and basically being opaque, so eye in the light can only pass through the cornea, right? These are all the functions of the sclera. Another function of the sclera is that it acts as a point, or rather a source of insertion of the extraocular muscles. What are the extraocular muscles? So think about it. Can you move your eye? Yes, you can. If I ask you to look to your left without moving your neck, can you do that? If you don't have any pathology in your eye, you probably can. You can move your eyeball to the left, you can move your eyeball to the right, you can move your eyeballs up and down. Why can you do that? Any movement in our body needs the muscular or the skeletal system as well. In the eye, there is no skeleton to actually do that, but there is a muscle, or rather, there are muscles to help with the movement of the eyeball as a whole. So, these are what we say to be the extraocular muscles. Extra means outside, ocular means eye. So these muscles are not a part of the eyeball as such, but rather they insert into the eyeball at different points. We'll look at them in great detail later. Where exactly do they insert in the eyeball? In the sclera. So this is another function of the sclera. Done? Done. Now let's go to the middle layer. This is where this image needs to be a lot more clearer to us. So remember, I had told you that, okay, let's just keep this one for now. Remember how we got this picture? I've already explained to you, we took a transverse section of the eyeball and then we are looking at it from above. That's how we got this picture. Now, anything in white in this picture is the outermost layer. Just like that, anything in red in this picture is the middle layer. And anything yellow is the innermost layer. Okay? So, based on that information that I've just given you and the heading of this slide, we'll be talking about the middle red layer. Why have I colored it red? I've done that intentionally because the middle layer is also known as the vascular layer. Vascular layer. Why the vascular layer? Because obviously vascular means it's related to blood vessels. So the blood vessels actually travel through this layer. Eye as a whole is an organ and it needs obviously nutrients, it needs a blood supply. So the blood supply, and as far as the blood itself is concerned for the eye, it travels through the middle layer. That is why it's known as the vascular layer. Okay, done. Now, this middle layer, which is the vascular layer, it also has another name, and that is the more important name that you should remember. It is known as uvea. Okay, uvea. Outermost layer as a whole did not have a name, but middle layer as a whole has a name, which is uvea. Uvea has 3 parts. Again, just like the outermost layer having 3 parts, the middle layer also has 3 parts. What are they? One of those parts I've already talked about, the iris. Let me just do it in blue. Iris. Then the ciliary body. And thirdly, choroid. So these 3 are the parts of the middle layer, also known as uvea. Okay. Now let's look at them individually, or rather let's at least label them in this picture. So if you can see, this over here is the iris. Or let me just Since we already have iris written over here, let me just, do this. So this, and over here this as well. Whatever I'll be labeling on the right hand side will also be evident for the left hand side as well. Now, see this iris. What exactly is this iris? Iris is actually, it is a muscular layer and a pigmented layer as well. So that is why I have used blue here for labeling iris. See, this was the iris. This is the iris. Okay, this entire thing, this entire blue pigmented part of our eye, or rather our eyes have different colors because of what? It is because of the iris. Okay, so is iris, even though we can see iris from outside, is iris a part of the outermost layer? I've already talked about this. It is not. It is part of the middle layer, but since the cornea is transparent and acts like a window, so we can see into the middle layer, or rather a part of it, that is the iris. Okay, so iris is pigmented obviously because it is colorful. As we can see, it can be of different colors. Dark brown for me, some have gray, some have light brown, some have blue, some even have green. So anyways, over here I've used blue because it is more discernible as far as the picture is concerned. So that over here is the iris. Done. Then we have ciliary body. Okay, ciliary body is nothing but this entire thing. This is the ciliary body. What exactly the function of it is, we'll see later. Then this entire red portion left, this is the choroid. Okay, done. So, and this basically, this was the cornea. So basically this was transparent. That is why you could see the iris. Remember? That's why we could see the iris. Okay. So all of these structures have their own different functions. The iris has function, the ciliary body has function, and the choroid obviously has its own function. We'll see to that later, what exactly the function of it is. Since we are talking about the middle layer, let's talk about another accessory part of the eyeball, which is not exactly a part of any such layer as such, but is one of the most important structures in the eye. That is this thing over here, the lens. So basically, as is evidenced by its name, the lens is basically what? We need something to converge the light rays onto the image forming part of our eye. That is where the lens comes into play. Okay, so the lens is suspended in the middle by these green structures from the ciliary body. These green structures are what we say to be ciliary processes. Ciliary processes. Okay, done. So lens suspended by ciliary processes from the ciliary body. In front we have the iris, and in front of that we have the cornea, which is transparent, and the cornea becomes the sclera, which is the white portion. Cornea and sclera, their junction is known as limbus. Ciliary body, iris, and this entire back portion of the middle layer or uvea is known as choroid. That is the anatomy that we have covered until now. Okay. Okay. Now, see, I have labeled, or rather, if you look at the ciliary body itself in the drawing, I have marked it somewhat differently. This entire thing is ciliary body, whatever is within the brackets, but look at how I have marked it. Some part of it I have marked in black dots, and the other is plain over here. This black dotted part is known as pars plicata, and this smooth part over here is known as pars plana. Again, whenever anything is given a separate, different name, it is because of some reason. There is some reason behind it. So obviously that means that the pars plicata and pars plana, which by the way, if you are confused, are parts of the ciliary body itself. So the ciliary body has two parts, pars plicata and pars plana. Excuse me. Why exactly is it named pars plicata? Because it is thrown in plications, as you can see over here. Right? Can you see? Right? So these are thrown in plications. It's thrown in folds for the ciliary processes to attach. That is why it is known as pars plicata, and pars plana because it is plane. Obviously, different names means different functions, different anatomical views. Something is different in them. That is why they have different names. What is the difference in them? What functions they serve? We'll talk about that when we talk about uvea as whole. Done? Done. Now, let's move on to the last layer, which is the yellowish portion over here, the innermost layer. The innermost layer is known as retina. As you can see, retina is not a complete layer. It is only present beyond the pars plana, only in front of the choroid. Yes, very good. See, retina is only present in front of the choroid, not in front of pars plana or pars plicata or any of the other structures. So we can say that the retina is an incomplete layer. What exactly is the innermost layer or retina as far as its function is concerned? We'll talk about it in great detail later. But obviously, if we are to sum it up, it is basically the neural layer, which means the nerves, the nerve fibers of the entire eyeball, they all merge here, they all bundle up together here, they are all running around in here, and then which means this actually forms the visual impulse. So the visual impulse formation, the vision, or rather the image being formed in our eye is in the retina, the neural layer. That is the function of the retina. We'll obviously talk about it in a lot more detail later, but for now this will do. We are only just laying down the foundation. That's all we are doing right now. Okay, done. So this is the basic overview of the different structures, of the different layers. So the outermost layer, the middle layer, and the inner layer, and their different parts. We have seen them. Now another thing that we have to deal with. See, we have been looking at the eyeball from front, so we have been taking a transverse section. Now what we have done is we have taken a sagittal section. Okay, a sagittal section, that is, suppose this is the orientation of the patient, or rather not the patient, or the person. This is his eye. Now we are seeing the eyeball. Okay, so we have cut it. We have basically like put a saw we have put a saw through this person. We have cleaved him in half, or rather at least his eyeball in half, through the vertical section, or rather the sagittal section, and now we are looking at it from the side. So now we are not looking at the eyeball from the front, we are looking at it from the side. Okay, so when that is the orientation, now that you know, this is the anterior part, this is the posterior part. This over here is the optic nerve. Remember, I had talked about the retina being the neural layer. So the nerve fibers in the retina, all the nerve fibers, they bundle up and they exit the eye as the optic nerve. Okay, we'll talk about it in detail later. This structure in the middle, as I had talked about before as well, is the lens. This here is the cornea. This red colored portion is the iris. We have the ciliary body and all of that as well, but for better understanding of what we are to study right now, I haven't drawn them to make the drawing less congested. All of this is obviously the sclera. Now, what exactly are we studying right now? See the topic, spaces in the eye. What does that mean? See, as is evidenced by this drawing, there are different spaces in between the different structures within the eye itself. So for example, let me first label it up. So first, this is a space, this is a space, and this entire thing is a space. What is the first space in between? The first space is in between the cornea and the iris. Okay. The second space is in between the iris and the lens. The third space is in between the lens and the retina. These are the different spaces within the eyeball. Now, the names for these spaces. The first space is known as, very, very important. Let me choose a different color here. Let me go with, I don't know, green probably. Or let me use yellow. I'm very indecisive, I'm sorry. This is known as the anterior chamber. Very, very important. The second space is known as, oh, very good, you have guessed it right, the posterior chamber. Now, okay, the third space. We have already dealt with anterior and posterior chambers. So posterior chamber is already done. What can be the name of the third space? It has to do with something posterior, right? It is posterior segment. Interesting choice of a name. Anterior chamber, posterior chamber, and posterior segment. That does not exactly seem very symmetrical, right? As far as names are concerned. Let's make it symmetrical. So this anterior chamber and posterior chamber together, they form the anterior segment. So now are you happy? 1 and 2 together make up the anterior segment. 3 is known as the posterior segment. Why again have we divided the eyeball into different spaces and have named them differently? Again, there is some reason. Different names means different functions. Some significance is there. As it so happens, anterior segment, the entirety of the anterior segment, that is the space in between the lens and the cornea, is filled with a substance, a very watery liquid substance known as aqueous. You have probably heard of this. What exactly is the function of this aqueous, or why exactly do we need aqueous? Why does the eyeball need to be filled with some form of a liquid? As it so happens, again, I have said this before, eye is an organ. So obviously it would need what? Nutrients, oxygen, right? Now think about it. It needs nutrients, so it needs blood supply. But can the cornea, a transparent structure, have blood supply? Cornea is a what? A transparent structure. So if it needs blood supply, if it needs nutrients, if it needs oxygen, it needs to rely on the blood like every other tissue in the body. But can it get blood supply? Can it have its own blood vessels? It cannot. Why? Because it's a transparent structure. If blood vessels are running in the cornea, then obviously it won't be a transparent structure. For cornea or for any transparent structure to remain transparent, it needs to be what? Spotless. So we cannot have blood vessels running into the cornea and stuff like that, right? So what our body did, what we did was, we have kind of substituted blood for another transparent liquid within the anterior segment known as the aqueous. This is one of the functions of the aqueous humor. It is also known as aqueous humor. Okay, so aqueous humor, it is providing the nutrients, taking up the waste products or whatever from the cornea, from the different parts of the eye as well. And another very important function of the aqueous is, it also is responsible for something called IOP, intraocular pressure. As is evidenced by the name itself, intra, within, ocular, eye, pressure. So within the eye, there is some form of a pressure. Very, very important. There are different pathologies which lead to increased IOP, different surgeries of the eye which lead to increased IOP. Very, very important as far as the medical knowledge on the eye is concerned. So, aqueous leads to the IOP formation in the eye. That is the intraocular pressure. There is some form of a pressure in the eye due to the aqueous flow. Okay. Now, aqueous outflow, there are different facts about aqueous humor. So basically it has been found that the aqueous humor, it is being formed somewhere and then it is also going out through somewhere. So basically this is like a circulatory system, right? Why? Because I just said that aqueous is acting like what? It is acting like a reservoir. It is acting like a source of nutrients, and it is also taking out the metabolic wastes that are being generated in the eye tissues. So it needs to be circulated. So that means there is a rate at which the aqueous is coming in and there is a rate at which it is flowing out. Okay? It means there are two facts that we have to remember. The rate of outflow of the aqueous, which happens to be approximately 2.3, or rather not 2.3, let me not 2.3, 0.25, 0.25 microliters per minute. Okay, this is the rate of outflow. Then what is the rate of formation or rate of inflow? The rate of inflow is 2.3 microliters per minute. So 2.3 and 0.25, these are two important facts that you will have to remember. Okay, this means the aqueous exerts pressure, and the rate at which aqueous is flowing in, the rate at which aqueous is flowing out will ultimately decide the intraocular pressure. By the way, intraocular pressure, we'll talk about this in great detail later, but for now, just another fact about the intraocular pressure of the eye. It is measured by something called tonography. Tonography. Okay. Did I say tonography? I'm sorry. Not tonography, it is called tonometry. My bad. See, this is again, these are mistakes that we often make. So it is actually good that I'm making this mistake right now, so you may probably not make this mistake. Metry means measurement. Tono in this case, anything related to tono means pressure, intraocular pressure, or related to the aqueous. Okay. Why did I say related to aqueous? Because there is another term. What is that term? This is becoming very congested. Let me make another slide here. Yeah, so there is another term. I just said that tonometry is measurement of IOP, intraocular pressure. How there is, we are going to make an entire video on how to measure intraocular pressure when we'll talk about a very important pathology of the human eye known as glaucoma. Okay. For now, just remember this term, tonometry. Then there is another term, tonography. Tonography means the measurement of the aqueous outflow. The measurement of aqueous outflow is known as tonography. Okay, so tonometry and tonography, please do not get confused with these two very similar sounding words. Now, let's go back to our, So, remember I had said that the anterior segment contains the aqueous. So what does the posterior segment contain? Does it also contain something? Yes. The posterior segment contains what we say to be the vitreous. So anterior segment contains aqueous, posterior segment contains vitreous. Unlike anterior segment's aqueous, which was watery in its consistency, liquid, had rates of outflow, inflow, exerted pressure, was responsible for intraocular pressure. Vitreous is a jelly-like substance. It's almost like a jelly-like substance. So it is kind of semi-solid. Why is it semi-solid? Because of its constituent, which is 1% hyaluronic acid. It contains 1% hyaluronic acid. That is why its consistency is not exactly watery like the aqueous, but rather gel-like. Okay. What the function of the vitreous is, again, we'll talk about later. So these were the spaces within the eye, and with this we kind of finish with the overview of the eyeball as such, as far as its anatomy is concerned. Now from the next video onwards, we'll be dealing with the individual layers or parts of the eyeball in detail. We'll talk about the sclera, the cornea, the limbus, their different pathologies. Then we'll talk about the uvea, the iris, the ciliary body, the choroid. Then we'll talk about the retina and its pathologies. And retina is going to be like a completely different section itself. Very, very important, very, very interesting. This is just the beginning, I think, of our ophthalmology journey. Hopefully you found this somewhat decent. I know I'm not that good a teacher. I try, but hopefully I've been able to, give you at least some bit of an overview as to how the anatomy of the human eye works. This was the overview. This was the foundation. Hopefully you found this useful. Thank you very much for watching this, and I'll catch you guys again in the next video. Next video is going to be on sclera and cornea. That is the outermost layer of the eye. Okay, bye. See you.